Hi, I'm Chandler Griffin, and I'm the Communications Director for San Juan Basin Public Health. Thanks for joining us for another one of our bi-weekly COVID summaries. And as you have probably heard by this point, we are in the midst of a severe Omicron surge in our community in La Plata and Archuleta counties, and then also statewide and across the country. Earlier this week, the state of Colorado estimated that between 1 in 5 and 1 in 10 Coloradans are currently infectious with COVID-19. We have seen about a 5-fold increase in the daily positive cases in our community since before the holidays. And so what this points to is the high transmissibility of the Omicron variant and its ability to really outcompete the Delta variant that we were dealing with in the fall and earlier in the winter very, very quickly. And now Colorado is estimating that it has reached nearly 100% of the positive cases that are coming back from COVID-19 testing. So this is a very serious surge. We want people to be aware. We don't want people to panic. We are fortunate at this point in the pandemic to have more tools at our disposal for keeping ourselves and our families safe, and especially protected from severe illness and hospitalizations and some of the worst outcomes from this virus. The prominent tool that we have are the vaccines and the boosters. Especially with the booster doses, they have been shown to be highly effective at preventing severe disease, even with the Omicron variant. So if you're eligible for a booster, please visit our website and sign up for an appointment as soon as you can. The eligibility timelines have changed slightly this week. The CDC and the FDA decided to shorten the timeline for booster eligibility for people who received the Pfizer vaccine. So if you have finished a 2-dose series of the Pfizer vaccine, you can get a booster dose 5 months after that. And the Pfizer vaccine is available for all residents ages 5 and up. If you are an adult and you received the Moderna vaccine, the booster is available to you 6 months after. And if you are an adult who received the Johnson & Johnson 1-dose vaccine, you'll just have to wait 2 months before you receive a booster dose of any of the 3 vaccine types. Mixing and matching is allowed for adults. We also want to point to our public health advisory that is still in effect. This is a formal public health advisory with strong recommendations that all individuals mask up when they go into businesses and public indoor spaces with a well-fitting and high-quality mask. And that means that it fits over your nose completely, under the mouth, and that you wear that, when you go out to do your errands or go to the grocery store. Having the vaccine and the booster and masking will go a long way towards controlling some of the spread in this current Omicron surge. We also want to let you know that the community testing sites are still available to the public. Testing at those sites is free. And while they are experiencing a really busy period due to the Omicron surge, you can make an appointment on our website. Please try to show up on time for your appointment. That really makes the process smoother when you go to the community testing site. And it continues to be really, really important that you do that if you are exposed and especially if you develop any of the symptoms of COVID-19. As a community, our top priorities during this current surge are preserving healthcare capacity, protecting our essential workers, and preserving hospital capacity, and then really maintaining in-person learning. We know how important in-person learning is for the academic, social, and emotional benefits it delivers for our children. And by following the precautions, we can help support in-person learning in our schools, which we know is so important. So we just want to thank you again. This is the challenging time, and we recognize that people were really hoping that we would have normalcy, over the holidays and at this point in the pandemic. And unfortunately, the virus has, presented a curveball with this highly transmissible variant. But we do have good tools at our disposal, and we do thank you so much for your continued participation in keeping the community as safe and healthy as possible. Thank you very much.